Namaskar and good evening. I must congratulate and compliment every single gentleman and lady and the organizers of this event, the award winners, obviously, in particular. The value of anything and anybody is always known when we do not have it. Just for a moment, imagine what would have happened to the tens and thousands who would have missed being touched by the brilliant work that each and every one of you have been doing for years together. Your immense contributions, be it in detection, in screening, in prevention, or curation of diseases, usage of technologies, putting in long hours of work day in and day out, traversing the country and the world. Imagine what would have happened if God had not made each one of you who you are today. Health is not like mathematics. In mathematics, 10 plus 10 could be 20. But in health, 10 plus 10 could be 100 or 1000. What I mean by that is your kind intervention, your care and cure to people does not just bring care and cure to that one individual, but it touches a family, it touches the community, it touches the society they live in, it touches the country that we all live in, and the world that we all also live in. That is the power of each one of you and the work that you do, that you are unleashing day in and day out. Be it any specialization, be it any disease that you work right from a mega to a micro level, you are ambassadors of goodness, you are ambassadors of goodwill, and you deserve gratitude and pranams by every single member of the family that you touch with your lives. To all of you, I offer my pranams and namaskar for what you do. In the same way, what Satyasai does for over 55 years is we take care to the unserved geographies and unserved populations, both of this country and the several unserved continents of the world. India, as all of you know, is a country of over-medicalization and vast under-medicalization. We sit in beautiful rooms like this. We are deeply moved in the heart of those in need and those suffering and those whose pain we wish to alleviate with our work. Satyasai has for over 60 years worked under the principle of serving the unserved. And this we do by setting up institutions, creating models of care and excellence. I would dare say that because we were invited in 2010 by the Government of India to address a key problem of newborns in this country. Dr. Keshav Desiraju, who was Secretary Health Ministry of Health in Government of India, a dear good friend and sadly no more at this time, said India needs to invest in its children. We were all children one day. And congenital heart diseases are commonest defects at birth amongst all newborns in our country. And that led to the work of Satyasai and Satyasai Sanjeevani, where health was not viewed as an expenditure. but as an investment. Through the work and the brilliance of the work that each one of you do, you're investing into people. It is not the bill that matters, but the investment of your care and cure, your experience and expertise that touches these lives. The impact of this will happen and reap benefits when they go out of your clinics, out of your hospitals to become contributory citizens to the family and to the community and the society that they live in. So, a healthcare worker, and each one of you sitting here is a nation builder. You are transforming the world. You may not know it because maybe or may not be you didn't take that approach. But for somebody who lived and worked in healthcare from 1969 to today is 2025, I have believed that each one of you have contributed to the better health, the well-being, the wellness, and thereafter the progress and productivity of our nation. Just to give you an idea of what we do, just as a bit of information, I was so impressed with the discussions, particularly of the advent of technologies, computer sciences, artificial intelligence, and of course, various preventive and detective screening mechanisms in the space of cancer. Let me tell you something which possibly none of you have heard. We work in a collaborative model with Tata Memorial, wherein we are their partners for congenital cancers. So children born with cancer come to Satya Sai for cardiac clearance, and thereby began a 25-year-old association with Tata Memorial and with ACTREC in Kharghar, where we do extensive and in-depth genetic research, which is of course extensive in cancer, but also into congenital diseases. So here we came out with a program which I would call, and I think which would be useful information to you, is how do we take class to mass? When we speak of individualized healthcare, individualized detection and screening, that is extremely important because your well-being, your health, and your ability to be productive is extremely important. But think of the 85% of the masses that live in the tribes, in the hills, in rural Adivasi geographies. How do we take class there to these masses? Yes, I must admire and acknowledge and appreciate the usage of digital technology. So I'll give you a couple of examples. A collaborative model which Satya Sai works with Tata Memorial, with Satya Sai, and the Institute of Public Health and Nutrition and Research is a beautiful model. We take care of the ASHA workers in 3 of the most aspiring backward states of India, of Jharkhand, of Chhattisgarh, and parts of Maharashtra. What is this program? You know, ASHA workers, to all of you, I'm sure you are aware, they are the foundation of the public health system, of the maternal and infant health system of our country. Normally, they do not get recognized or supported. The only time they possibly congregate is to put out their rights and ask for their demands for their better pay or better emoluments. A program that was launched especially for the ASHA workers who are predominantly women resonates with what the last panel discussion was. We spoke of breast cancers and cervical cancers. It is also rampant amongst them. So this collaborative initiative, and I'm sure you will put your hands together to this, was Tata Memorial in collaboration with Satya Sai. Every single ASHA worker in these states is provided totally free of cost cancer cure and care for cervical cancer, breast cancer to every single ASHA worker. This is an immense contribution because it has a ripple effect. That ASHA worker will help hundreds and thousands of families who will have nowhere to go to get a delivery or a birthing done. And this is the contribution each and every one of you is making. I want to give you the manifold picture and the manifold contribution that you are making. The second is the usage of AI and technologies. I was so moved and inspired by this. You can tell me to buy an Apple Watch. Honestly, I may not be able to afford an Apple Watch. I don't even have one. But yes, we use AI in a very different way and something which will resonate with all the gynecologists and the maternal health specialists, even in the cancer space. Anemia, low hemoglobin is a rampant issue in India. I think all of you will unanimously agree to this. Young adolescent girls, school going girls, or even young women in rural geographies or even urban geographies, our hemoglobin levels are so low. And especially in a maternal space, when during pregnancies, there are alarming figures of 5, 4, 3, preeclampsia, and whatever you have. So, what do we do? How are you going to detect? I also saw an award being given to sickle cell. We have the largest pediatric cardiac hospital of India, of all states, in Chhattisgarh. We do 25 open hearts a day on children in Chhattisgarh. Totally free of cost is a different matter. But what I want you to know is, in our vast mother and child hospitals across the rural tribal geographies of our country, we see such a sad reflection and manifestation of anemia. Now, how many can you take to a laboratory? How many can you take a blood sample, and which laboratory are you going to go into? Bastar or into the hills in Himalayas or into the Adivasi populations in Saraikela or East Singhbum district where we work in Jharkhand? There is no laboratory there. There is nothing there. So that is where AI and digital health comes in, and I want to salute each one of you. So we have come up with a technology. Today, everybody in my generation, I spoke on a phone like this or I dialed a telephone. Today, everybody, even a rural woman coming to our hospitals, speaks on a phone like this. Initially, it was strange to me, but she's doing a video call there. Now, we use a simple phone, and as you're speaking and looking at me, I will take an image of your eye. And with that image, ladies and gentlemen, with the technologies you spoke of, we can detect your endocrine status, your hemoglobin status, and your lipid profile. This we have unleashed into tribal and rural geographies, touching hundreds and thousands of women whose hemoglobins are low. So this is what we do, and this is why, and this is the only conclave I've ever come. It's an honor to have met each and every one of you. And believe you me, I think doctors need to realize that you are nation builders. Consciously, subconsciously, you are building the India. You are building the generations that will come. Your work is not just by the patient you're seeing here today and now, but its family and its children who will come from. So the overall gratitude and goodwill which those families, those communities will pay to you is immeasurable, and you would not have thought about it. It is always rightly said in our scriptures, Vaidyo Narayana Harihi. Satyasai Sanjeevani also says, patient Narayano Harihi. Even the patient we serve is God Almighty. And what you do is a seva. I don't ever say a doctor works, a doctor serves, a doctor touches, and God works through each and every one of you in touching millions of lives, millions of hearts, and millions who will come in generations to come. God bless each and every one of you for the brilliant work of that you do and the brilliant work you will do for times to come. Namaskar and God bless.